HESC 114, Intro to Pharmacology, Chapter 13, Psychiatric Drugs. Chapter 13 covers disorders of the mind. It includes emotional disorders that affect personality, mood, and/or behavior. Many of these disorders have physiological causes due to chemical imbalances that can be realigned with medications and are generally treated in the short term. Other disorders require lifelong treatment. On your screen are the learning objectives for Chapter 13, which can also be found at the beginning of Chapter 13 in your textbook. Neurotransmitters are chemicals that relay messages from one neuron to the next. They are key neurotransmitters that play a role in neurological disorders. We're going to go through these and identify what area of the nervous system or brain that is associated with each of the following neurotransmitters. Epinephrine, also abbreviated EPI, epi, is a neurotransmitter of the sympathetic nervous system. An increase in epinephrine can cause anxiety, phobias, or panic attacks. Norepinephrine, identified with the abbreviation NE, is a neurotransmitter also of the sympathetic nervous system. It controls involuntary processes such as the heart rate, respiratory rate, and blood pressure. An increase in norepinephrine can cause aggression, obsession, and mania, where a decrease in norepinephrine can cause depression. Dopamine, abbreviated DA, is a neurotransmitter that is important physically in muscle control and psychologically in reward-motivated behavior. An increase in dopamine can cause schizophrenia and has a role in bipolar disorder, and a decrease in dopamine is associated with Parkinson's disease that we reviewed in Chapter 12. Serotonin, known as 5-HT, is a neurotransmitter that helps the brain cells communicate with each other. It is also active during sleep, eating, and digestion. A decrease in serotonin can cause depression, where an increase in norepinephrine with a decrease in serotonin can actually cause violent behavior. GABA, gamma-aminobutyric acid, is an inhibitory neurotransmitter. It is the main neurotransmitter in the brain, the cerebral cortex. It keeps neurons from being overstimulated. If we have an insufficient level of endogenous GABA, what's made in our body, it can result in anxiety. We're going to look at the different types of neuroses. Anxiety is the primary neuroses. The treatment of neuroses involves the use of anti-anxiety drugs, which are also known as anxiolytics or minor tranquilizer drugs. Interestingly, some patients with anxiety disorders are also treated with certain antidepressant drugs. The first-line treatment for these conditions will either be a benzodiazepine or an antidepressant drug. I'm going to go through each of these disorders, and then I've grouped the drugs as to which ones are used to treat what. So it's a little different layout than your textbook. So first is general anxiety disorder, which is sometimes referred to as GAD. It has symptoms of constant, persistent worry about a number of things, like your health, your finances, your family. It can includes an inability to stop worrying, and trouble concentrating, and can include restlessness. OCD is obsessive compulsive disorder. It's characterized by constant, persistent, and uncontrollable thoughts, obsession, that can cause anxiety and compel a person to perform excessive, repetitive, or meaningless actions. These are the compulsions. And they have to do these compulsions in order to relieve the anxiety. These repetitive actions occupy hours of each day and can involve cleaning, checking, hoarding, arranging, labeling, any activity that has to be done recurrently. Although individuals know their behavior is excessive and unreasonable, they are unable to control it or stop it. Panic disorder is another condition involved with anxiety. It involves having a sudden episode, a panic attack, which is severe and overwhelming anxiety, fear, and feelings of panic that have no identifiable cause. The physical symptoms are intense and can even mimic a heart attack. PMDD is premenstrual dysphoric disorder. It's a mental illness that occurs in females before the onset of each monthly menstrual cycle. It includes the physical and emotional symptoms of premenstrual syndrome, which include breast tenderness and joint and muscle pain, but to a much greater degree than seen in PMS. It also includes symptoms of depression, anxiety, tearfulness, difficulty concentrating, and sleep disturbances that significantly interfere with life activities. PMDD is a mood disorder caused by an alteration in the level of neurotransmitters in the brain. PTSD is post-traumatic stress disorder. It is a chronic, disabling reaction to an excessively traumatic situation or event. The person feels helpless and numb while mentally reliving the traumatic event over and over. Other symptoms can include anxiety, insomnia, irritability, and a numbed response to people and life events. In the past, this sometimes was referred to as combat fatigue or shell shock. Social anxiety disorder is also known as social phobia. It's characterized by anxiety and fear in social situations such as crowds, stores, meetings, parties, and also during personal encounters, sometimes even on the telephone or when meeting a new person. There is also a fear of speaking to strangers and authority figures or speaking in front of an audience. Physical symptoms can include extreme nervousness, sweating, blushing, tremors, nausea, stammering, an inability to think clearly, and fear of being the center of attention. Okay, so now that I've reviewed what the different disorders are, because the book is very repetitive, it's got all these breakouts by condition, the medications are the same. I'm actually going through the medications and grouping them into the conditions. So benzodiazepines are often used in anxiety disorders. Their benefit is that they are GABAergic. They enhance the effect of GABA, because a low level of GABA is thought to create anxiety. Benzodiazepines also produce sedation. They affect the spinal cord to decrease muscle tension. Both of these help to decrease anxiety. All benzodiazepines are control schedule 4 drugs. So on your drug list you had alprazolam, which is Xanax. We see it here. It could be dosed, it could be split. We see that it's a scored tablet. And then clorazepate is another drug in the benzodiazepine. Now, most of your benzos have that PAM or LAM drug stem, as we see with alprazolam. Clorazepate is an exception. It's one of the very first of the 2 drugs that were in the class to start with. Chlordiazepoxide was the other one. So this one does not have the PAM or LAM. So you're going to have to know, oh, that's the exception to those drug stems. Now, antidepressants can be used in treating anxiety disorders. So SNRIs can be used for GAD, panic disorder, and social anxiety disorder. SSRIs are effective in treating OCD, PMDD, and PTS. And tricyclic antidepressants are also used in treating OCD. I'm going to talk about antidepressants later in this chapter, so I'm not going to take the time to explain how they work at this point. There are other classes of drugs that can be used to treat anxiety, such as beta blockers. Beta blockers like propranolol, talked about that with migraines, Inderal. It helps to alleviate physical symptoms, and it helps lower the heart rate. If you're feeling anxious, you sometimes feel like your heart is racing. So beta blockers like propranolol can help treat that. Buspirone is an atypical anxiolytic. Its only indication is for anxiety. So here I have a picture of a buspirone label as well as a tablet. And again, it's split, so a patient may take it twice a day, and on the other side, in case the doctor orders it 3 times a day, they might split that tablet. Barbiturates are also used in treating anxiety, but usually not the typical anxiety disorders, but we use it preoperatively to reduce anxiety before a patient goes into surgery. Barbiturates will produce sedation in an anxious or agitated patient, and that's why they're beneficial. So Amytal is amobarbital, and Barb, talked about that previously, Barb or Barbit is the drug stem for a barbiturate. Amobarbital, butabarbital, and phenobarbital can all be used. They all are different control schedules. Your amobarbital is a C2, your butabarbital is a C3, and your phenobarb is a C4. Next are psychoses. A psychotic symptom is based on the overactivity of the neurotransmitter dopamine. The most common form of psychosis is schizophrenia. There are 2 categories of psychoses, major psychoses and minor psychoses. Major psychoses is a lifelong disorder. The onset is usually late in the teens or early 20s, and most often the patient will have a familial link. Treatment of major psychoses includes antipsychotic drugs, also known as neuroleptic or major tranquilizer drugs. Now, the textbook refers to first and second generation antipsychotics. Generally, in practice, first generation psychotics can also be identified as typical, conventional, or traditional antipsychotics, and second generation antipsychotics are sometimes referred to as atypical antipsychotics. The first generation antipsychotics, the conventionals, are older. They include drugs such as phenothiazine and have more severe and potentially permanent side effects than the newer atypical antipsychotics. These side effects are known as extrapyramidal symptoms, or EPS, and they kind of mimic characteristics associated with Parkinson's disease, because these older antipsychotics block dopamine receptors. So it creates that imbalance between dopamine and acetylcholine. So tremors is the most common thing that we notice, or tics, in patients who use the older drugs. And that's labeled as an EPS, or an extrapyramidal side effect. So the first generation, or the conventional antipsychotics, they're going to block dopamine receptors. Phenothiazine drugs were developed for treatment for psychosis. These drugs block dopamine, histamine, serotonin, and alpha-adrenergic receptors. As a result, several of the drugs are used for other indications in addition to psychosis. One of the most common uses is treatment for nausea and vomiting with prochlorperazine or promethazine, Phenergan, and compazine. Prochlorperazine is compazine, promethazine is Phenergan. Phenothiazines will have the drug stem thiazine or phenothiazine. The book gives azine, but there's other drugs that end in azine, so it's not quite enough. The drugs on your list in the conventional or first generation include haloperidol, which is known by the brand name of Haldol, or thioridazine, which is actually a phenothiazine, and that brand name would be Mellaril. Because of the side effects of these antipsychotics, many patients don't like the side effects. They don't take them as they're supposed to. When patients don't take their medication as they're supposed to, it's known as non-adherence or non-compliance. Patients who have psychoses, such as schizophrenia, have to take these drugs for the rest of their life. If they miss a dose, then they can start to spiral out. Now, your second generation antipsychotics are referred to as atypicals. They block dopamine and certain serotonin receptors. The drug stem for these usually include edone or apine. Here we have clozapine, which is known by the brand name Clozaril. And then we have olanzapine, which is the brand name Zyprexa. Now, there is an injectable form of olanzapine known as Zyprexa Relpev. If a patient receives that, they could have fainting episodes. So they have to be watched for up to 3 hours after the intramuscular injection. Quetiapine is another atypical antipsychotic, and its brand name is Seroquel. Dopamine stabilizer antipsychotics, in most books, this is actually grouped in with the atypicals, but they're going to help stabilize those dopamine receptors. These end in piprazole. So aripiprazole is Abilify. And we want to be careful because if you remember when we talked about the GI drugs in chapter 4, we had the oprazole and eprazoles, which can be the proton pump inhibitors. This is an iprazole or a piprazole to help identify that these are different. Now, Abilify is a drug that can also be used with other drugs to treat depression. That's what we call an adjuvant medication. The next disorder is depression. Depression is treated with antidepressant drugs. These agents will enhance the levels of serotonin and or norepinephrine. There are a number of antidepressant drugs, basically 6 classes. We're going to go through each of these. Again, many of these relate back to, they can also be used for other things. We can also use them in treating anxiety disorders. So first are the MAOIs. I don't know why the author put this first because this is one of the least used classes of drugs. It has the most interactions. MAO is monoamine oxidase. These are monoamine oxidase inhibitors, and there's actually a specific type. This is type A. I talked about MAOIs type B and being used to treat Parkinson's disease in chapter 12. MAOIs type A for antidepressant, they stop the enzyme monoamine oxidase that would break down specific neurotransmitters known as monoamines. Monoamine oxidase inhibitors are not the drug of choice when initiating treatment for depression, but they are only used to treat depression that has not responded to other drugs. Please review the drug alert in the textbook. Monoamine oxidase inhibitors have many drug-drug and drug-food interactions. The most commonly used antidepressant drug is an SSRI, which stands for Selective Serotonin Reuptake Inhibitor. They will selectively inhibit the normal reuptake of serotonin in nerve cells in the brain. When the serotonin level is low in a patient with depression, these drugs inhibit the reuptake and allow available serotonin to continue to stimulate receptors for a longer period of time. Many of these drugs end in citalopram or Oxytocin. You want to be careful because citalopram is not a benzodiazepine. It's PRAM, not azolam or azepam. So citalopram, brand name is Celexa. Fluoxetine is most commonly known by the brand name of Prozac. It also is available as Serafem because it's used for PMDD. And then sertraline, which is a little bit different, is available by the brand name of Zoloft. So again, the drug stem, be aware that citalopram or S-citalopram, it's that R, it's not PAM, it's PRAM. Fluoxetine, Prozac. Those are some of the stereotypicals. Now, the book does note that fluvoxamine also belongs to this category of SSRI drugs, but it's only used in the treatment of OCD. The next are SNRIs, which stands for serotonin norepinephrine reuptake inhibitors. They inhibit the normal reuptake of both serotonin and norepinephrine in the nerve cells in the brain. When serotonin and norepinephrine levels are low in a patient with depression, these drugs inhibit the reuptake and allow the available serotonin and norepinephrine to continue to stimulate receptors for a longer period of time. Examples of SNRIs include desvenlafaxine, which is known by the brand name of Pristiq, and our friend duloxetine, which is known by the brand name Cymbalta. We talked about duloxetine in the previous chapter, chapter 12. A serotonin reuptake inhibitor antagonist drug will inhibit the normal reuptake of serotonin and norepinephrine, but they also block or antagonize the action of serotonin and alpha-1 receptors and keep them from being activated. When stimulated, alpha-1 receptors can contribute to long-term depression. Trazodone can cause extremely vivid and upsetting dreams, which can lead to patient noncompliance in taking this drug. TCA is a tricyclic antidepressant. They are named because they have a triple ring configuration of their chemical structure. There's an image on figure 13-14 in your textbook. Tricyclic drugs block the reuptake of norepinephrine and serotonin in the brain and allow these neurotransmitters to bind with the receptors and prolong their action until they eventually break down. This helps correct the low levels of norepinephrine and serotonin found in patients with major depressive disorder. TCAs also have an anticholinergic effect. So again, we talked about TCAs being used to treat insomnia because they can cause drowsiness. So that comes from chapter 12. Now, there are two generations in this class. The first generation or older drugs have the drug stem of triptylin, as we see here, nortriptylin, brand name Pamelor. And then the newer drugs have mipramine or imipramine. So imipramine is known by the brand name Tofranil. Another use for imipramine, which is not in line with depression, but it's used for bedwetting. The sixth major class is the tetracycline antidepressant. Some books will refer to this as a heterocyclic antidepressant. This is going to block the reuptake of the neurotransmitter norepinephrine in neurons in the brain and allows the norepinephrine to bind with receptors and prolong its action until it is eventually broken down. This helps correct the low levels of norepinephrine that can be seen in depression. Oops. I don't have an image. I did not give you a tetracyclic on your drug list, which is why I don't have an image. But the drug meprotolin is used to treat depression associated with anxiety. For other drugs, these don't fit into the other classes and are sometimes referred to as atypical antidepressants. Other drugs used to treat major depressive disorders can include bupropion, which inhibits I didn't fix my little animations very well. Bupropion, which is an NDRI, it's a norepinephrine dopamine reuptake inhibitor. It prolongs the actions of dopamine and norepinephrine in the brain. It's used to treat depression, but another thing about bupropion, it's also used for people who are trying to quit smoking. Wellbutrin is the most common brand name of bupropion. Another one is the esketamines, which is an N-methyl D-aspartate or an NMDA receptor antagonist. We're not really sure how it works. We just know it does for depression. But Mirtazapine, which is pictured here, Remeron, will block alpha-2 receptors in the brain. Another drug in the chapter that it talks about includes vortioxetine, which inhibits the reuptake of serotonin and stimulates many different serotonin receptors. Well, there we go. I told you I had messed up on my animations here. So bupropion is an NDRI and mirtazapine is an alpha-2 receptor blocker. There are combination drugs. This combination drug contains an atypical antipsychotic, olanzapine, and an SSRI, fluoxetine, and it's called Symbyax, and it's used to treat the depression phase of bipolar disorder or depression that has been resistant to other treatment. Bipolar disorder, it used to be referred to as manic depression. It's important when a patient is being treated for bipolar, they are treated for both their manic episodes as well as their depression. The drugs that we use to treat bipolar disorder, it needs to be managed, and we can use many different drugs, including anti-epileptics, antipsychotics, lithium, or a combination. The depression can be managed with antidepressants. Drugs that lessen the severity of the frequency of the mood swings are known as mood stabilizing drugs. The anti-epileptic drugs are used to treat seizures, but can also be effective in treating both manic and depressive phases of manic depressive or bipolar disorder. We talked of anti-epileptics in chapter 12, so I'm not going to go through an extensive period discussing that. Antipsychotic drugs can be used to treat the manic phase of the bipolar disorder. Generally, we're going to use an atypical or second generation antidepressant in treating bipolar. Lithium is a salt. It inhibits the reuptake of serotonin and norepinephrine in neurons in the brain, but its exact action in treating bipolar disorder is unknown. However, lithium is used primarily to treat the manic phase. It is a narrow therapeutic index drug, which means the dosing is very patient-specific, and they can reach toxicity very quickly if it's not dosed properly. And then combination drugs. This contains olanzapine and fluoxetine. We just talked about this as an antidepressant. So Symbyax. Next is attention deficit hyperactivity disorder. Children with ADHD exhibit symptoms of restlessness, short attention span, distractibility, inability to follow directions, emotional instability, impulsiveness, and disruptive behavior. This complex of symptoms was previously known as ADD, or attention deficit disorder. They have added the component of hyperactivity, so ADHD may be the result of exposure. Added the component of hyperactivity. So sometimes we talk about it as ADD/ADHD. ADHD may be the result of exposure to alcohol or nicotine prior to birth, a premature birth, genetic factors, or head trauma. It is 2 times more common in boys than in girls. Many, but not all, children will outgrow the symptoms of ADHD in late childhood. Drug treatment for ADHD is accompanied by psychological counseling as well as special education interventions as needed. The drugs we use to treat ADHD include amphetamines and other related CNS stimulating drugs. These drugs help regulate the levels of norepinephrine and dopamine. These stimulant drugs exert what's known as a paradoxical effect. We would think that by increasing norepinephrine and dopamine, the patient would be overstimulated, but what it does is it actually helps for their attention to be more fine-tuned. They can hone in on things, and it increases attention span. Think about a non-drug product that many of you may use is caffeine. When you're feeling really tired and you can't concentrate, sometimes if you have something with caffeine, you're more alert and you're able to focus. These drugs work along those same lines. The most commonly used drugs to treat ADD, ADHD are stimulants, including amphetamines. Amphetamines and their derivatives, such as methylphenidate and dexmethylphenidate, are all controlled Schedule IIs. The drug here is lesdexamphetamine, and we see the brand name is Vyvanse, and it's got that C2 symbol on the label. Your amphetamine drugs will generally have the drug stem of phetamine, PH, ETAME, MINE, or FETAMINE. So the sound is the same. It's either going to be an F or it's going to be a PH. Amphetamine is spelled with a PH, but lisdexamphetamine, the drug pictured here, is spelled with the F in the phetamine. Other CNS stimulants, these are considered to be amphetamine derivatives, have the drug stem of phenidate. So the most commonly prescribed drug is going to be methylphenidate. Methylphenidate pictured here, we see that C2, these are controlled. There's many different brand names, including Concerta and Ritalin being two of the more common of the brand names. Non-stimulant drug, this is not a controlled substance. This is actually sold by prescription, is the drug atomoxetine, and atomoxetine has the brand name of Strattera. So this is not a controlled substances. These drugs include drugs that selectively inhibit norepinephrine reuptake in the brain. There's some others, including antipsychotic drugs like chlorpromazine or haloperidol, as well as alpha-2 agonists such as clonidine or guanfacine that can also be used, that are considered to be non-stimulant. But Strattera, atomoxetine, is the most common non-stimulant drug used to treat ADHD. Combination, a lot of times this would also be included with the amphetamines because it's actually a combination of amphetamines. This is amphetamine and dextroamphetamine. This is Adderall, and we added two together. It's just two different forms of an amphetamine drug, and these are also C2s. The last part of the chapter is talking about addiction. This kind of does tie into chapter 12 and a little even of chapter 5 as well. So some terminology. Addiction is a psychological compulsion that has persistent, intense urging. With drugs, this can be the result of physical and psychological dependence on the drug. Opioids, alcohol, and nicotine are the most common drug addictions, but not the only drugs to which a person can become addictive. With long-term use, a person may need more of a substance to get the same effect. That is a term known as tolerance. When the body could experience withdrawal from a drug, if it's not present, then the body becomes dependent on the drug or has dependence. Withdrawal can be dangerous when there is dependence. In addition to the symptoms listed, patients going through withdrawal can also have seizures. When a patient is having withdrawal from alcohol addiction, sometimes alcohol is abbreviated using ETOH. Patients will undergo medical detoxification to limit the adverse event. Benzodiazepines can be used and are helpful to the patient to help them tolerate their withdrawal symptoms, including anxiety and the potential for seizures. What we have on the screen right now are known as deterrents. These are used to maintain abstinence. So once a patient has completely undergone withdrawal, we don't want them to start drinking again. We want to have a deterrent. Deterrent or negative reinforcement. The drug on the left is disulfiram. It's available by the brand name Antabuse, so it's against abuse of alcohol. This drug has a specific interaction with alcohol that can cause severe side effects, including flushing, sweating, confusion, headache, blurred vision, dizziness, and nausea. It can even cause severe hypotension, a drop in blood pressure, and a racing heart. There is an anti-infective drug known as metronidazole, available by the brand name Flagyl, that is noted to have a disulfiram-like effect because of its interaction with alcohol. The second drug here is naltrexone, and this is an injectable suspension. This is known as Vivitrol. Drugs for withdrawal from opioid abuse disorder, which is known as opioid use disorder. Opioid use disorder can affect patients who have become addicted to prescription opioids or illicit drugs like heroin. Morphine is used to prevent withdrawal symptoms in addicts, but may be used to treat pain in patients who are opiate naive. That means someone who's not used opiates before. Like buprenorphine, methadone, which is a control 2, can be used for pain or for opioid use disorder. When used for opioid use disorder, methadone can only be dispensed from a registered facility. When used for pain, it can be filled at a pharmacy. Naltrexone is available by injection or oral formulation, and I had an image of that over here, the Vivitrol. So we can use Vivitrol for alcohol addiction or opioid use disorder. What it does is it blocks the pleasure center in the brain. Now, naloxone is known by the brand name Narcan, and it can be used to treat an opioid overdose. It's administered by injection, either intravenously or intramuscularly, or it can be introduced intranasally. So here we have that nasal spray. In Louisiana, naloxone can be purchased without a prescription. We have a Good Samaritan law that protects someone who administers naloxone to a person experiencing an overdose. The combination drug that contains an opioid agonist-antagonist drug, buprenorphine, and an opioid antagonist drug, naloxone, is known by the brand name Suboxone, and this is a sublingual film. So they're going to put this little film underneath their tongue. They should not cut, chew, or swallow this film. Okay, those are the disorders covered in Chapter 13. Now for some more questions.